Hello, everyone. Thank you so much for joining our overdose prevention and naloxone and fentanyl test strip training webinar today. My name is Ariel Palitz. I am the Executive Director of the Office of Nightlife. For those of you who don't know, we are a dedicated and non-enforcement liaison between the city and the nightlife industry and community. We are here today to bring you resources and training that are part of the city's growing efforts to combat the growing opioid epidemic. As you likely know, there is a fentanyl crisis in New York City, and fentanyl continues to drive overdose deaths in our city and was involved in 68% of all overdose deaths in 2019. As we also know, there is a stigma around the use of substances, and its association with nightlife can be particularly challenging. And we also know that substance use is a part of everyday life in many different settings throughout all times of day and many different industries throughout the city. But as representatives for the New York nightlife, we are here to help you to address these issues in your venues and in your lives. We know that nightlife spaces can often be safe havens where people can look out for each other. And so the Office of Nightlife is proud to be taking part in the city's harm reduction approach to address these issues by recognizing the need to help introduce harm reduction approaches in order to help save lives. It is not necessarily a condoning of drug use. It is a recognition of the reality of the challenges and the rising death rates with people that do use, and the need to present education and information to help save lives. And that is what today is really all about. It is important that we come at this with a harm reduction approach, again, to save lives rather than to only enforce what we know is real human behavior. That is also why the Office of Nightlife launched a new initiative called Elevate Nightlife to connect nightlife owners, workers, and patrons to free and low-cost mental health services, as well as drug overdose and suicide prevention information. You can find more information about that at nyc.gov/nightlife. And you can also find a more direct link to the mental health resources that we have. For today's webinar, we have a presentation from our colleague at the New York City Department of Health and Mental Hygiene, Yarelix Estrada, who is a field research associate with the Bureau of Alcohol and Drug Use Prevention, Care, and Treatment. Her presentation will include a brief training on the use of naloxone, otherwise known as Narcan, to combat opioid overdoses, as well as information about the city's new efforts to expand distribution, as well as information about the use of fentanyl test strips, a harm reduction tool that can detect the presence of fentanyl in substances. After her presentation, we will have time for a Q&A. So please use the Q&A feature in the Zoom throughout the presentation that we can ask her at the end. We will also be recording this presentation. Nobody's names or faces will be revealed, so it is completely confidential. And before we get started, I just want to remind everyone that the Office of Nightlife is always here to help you individually. You can reach out to us with any questions or concerns or ideas that you have anytime, especially if you're facing any difficulty with contacting other city agencies regarding all of the latest COVID regulations and guidelines. We are here to help you. So with that said, it is my pleasure to introduce our partner and presenter, Yarelix. Thank you.
Thank you so much, Ariel. And thank you all so much for having me for this presentation. As she mentioned, my name is Yara Alix. I use she, her pronouns, and I work for the New York City Department of Health. I work as a field research associate, and the majority of my work involves doing harm reduction work for people who use drugs in New York City in the hopes of reducing overdose across the city. So I'm going to show the presentation and begin that now. Thank you. Next slide, please. Okay, so this is what I'm going to go over today. First, going over overdose in New York City, where we're at in terms of the number of people who have passed from overdose. Talking a bit about fentanyl test strips and risk reduction when using drugs, as well as overdose safety planning and a naloxone training at the end. Next slide, please. So first, I want to start by saying that the words that we use matter. In general, when we talk about substance use or people who use drugs, we try to use compassionate and person-centered language. So we avoid using stigmatizing language that perpetuates negative stereotypes like addict, substance abuser, things like clean, because no one is dirty or clean. Like, you know, these words are just perpetuating a stigma that should not be continued. And so we want to use language that's more focused on the person as the individual who uses drugs, the individual who may be having or living through a substance use disorder, substance use or substance misuse, as well as someone who is currently abstaining or a patient, participant, or client. So these are just words that we like to use in general. That way it removes some of that negative like association with drug use and with people who use drugs. Next slide, please. So now I'm going to go over overdose data for New York City. Next slide. So this chart shows the unintentional overdose deaths that have happened from 2000 until 2019. And if you can see around 2015, that's when there was a very large jump from 2015 to 2016. That's around the time that fentanyl entered the drug supply in New York City. And we see how drastic that increase in overdoses was. This data is from 2019. And unfortunately, the data for 2020 is looking like, because of COVID and other issues, the rate has increased as well. But this, because we don't have that data finalized yet, we're presenting 2019 data at this time. Next slide, please. So every 6 hours, someone dies of a drug overdose in New York City. Next slide, please. And fentanyl is the most common substance involved in drug overdose deaths. There were 68% of drug overdose deaths that involved fentanyl in 2019. Next slide, please. And this chart shows all of the drugs that were associated with overdose deaths in the city. So 83% involved any opioid, 77% involved heroin or fentanyl, 51% involved cocaine, 28% involved benzodiazepines, 13% involved methadone, and 12% involved opioid analgesics or painkillers. So this just shows the spread of the different substances that have been found in the overdoses. And this slide shows the rates of overdoses by neighborhood. So there are definitely certain parts of the city that are more impacted by overdose than others. And we see like the top 5 are Hunts Point, Mont Haven, Highbridge, Morrisania, Cortona, Tremont, Fordham, Bronx Park, East Harlem, Central Harlem. And there are other places that are impacted as well, such as Stapleton, St. George, Union Square, Pelham, Trongs Neck, Rockaway. So these are areas that when we often do outreach or we do a lot of service delivery, we try to target these particular areas since they have such a high incidence and impact compared to other parts of the city. Okay. And now I'm going to talk a bit about fentanyl and risk reduction. So what fentanyl is and ways that we can reduce our harm or we can support others in reducing their harm. Next slide, please. So what is fentanyl? Fentanyl is a strong synthetic short-acting opiate. So there is a fentanyl that is prescribed, and it's prescribed for people that might have pain, chronic pain, or cancer. And these are prescribed in a pharmacy or from a hospital. But when we talk about fentanyl in the context of drug overdoses, we're talking about non-pharmaceutical fentanyl. So these are drugs that are made illicitly. There's no quality control. And so there's no real way of knowing how strong it is. And there's not consistency across the different batches. And it's typically 50 to 100 times stronger than morphine and 30 to 50 times stronger than heroin. We've been seeing fentanyl show up in heroin as well as cocaine and street pills. Also in these street pills are pressed pills such as heroin, such as Xanax or other opiates like Percocet, oxycodone, things like that. And there have been a few incidences from NYPD seizure data that it has been found in drugs like methamphetamine and ketamine. When it's found in these substances, they are cut in or pressed prior to purchase. And it's unclear how the fentanyl has gotten there, if it's been intentional or if it's been accidental in that, in the time that someone is bagging the drugs, for example, it may have accidentally mixed into other drugs that is not meant to be in. So improper mixing can lead to hotspots of fentanyl in drugs. That's sometimes when we see increases in overdose. And the strength varies greatly by the different kinds of fentanyl. So there's different kinds of fentanyl depending on how it's manufactured. And there can be some that are not as strong, and there can be some that are extremely strong, which can increase risk of overdose. And something else that's important is that fentanyl cannot be detected by sight, taste, or smell. And there's no reliable way to tell if fentanyl is present without testing for it. And so I'll talk a bit about that later. But it's not possible to grab, a sample of a drug and look at it and say this has fentanyl in it. That's not possible. And that's what makes it difficult for folks who use drugs, because unless they have items like fentanyl test strips, then, their risk of overdose is high because they won't be able to know if their drugs have this, if they're not seeking it. Next slide, please. So as I mentioned before, fentanyl has been found in heroin, cocaine, including powder and crack, methamphetamine, ketamine, counterfeit pills like Xanax, other kinds of painkillers or opioids, and other drugs that can be bought on the street or online. And there's a lack of understanding as to why and how fentanyl ends up in the drugs. All we know is after the fact, once we have that data of seizures or from overdose mortality data, is when we see that fentanyl has ended up in these substances. Next slide, please. So some things that we're hearing from the community are that some people are not seeking fentanyl and they are not aware that they're using it. And that has led to incidences in overdose because people may not have been seeking any opiate or fentanyl, but then it appears in their drug. People who sell drugs are not always aware of fentanyl being in their product. So some people who are selling may just receive their product in bulk and sell as is and not realize that it has fentanyl in it because they don't have mechanisms to test it. And fentanyl has a different high from the heroin high because it has a quicker onset and is more intense and is short acting, which is important when we talk about how it causes an overdose, because it's faster, because it's more intense, because it's stronger. So I'll circle back to this when I talk about overdose prevention strategies and how to respond to overdose involving fentanyl. Next slide, please. Well, in the same coin, there are a lot of people that intentionally use fentanyl. So fentanyl is definitely a risk for people who are opiate naive and for people who are not seeking to use opiates or fentanyl. However, because the drug supply has changed so drastically in the last 10 years, a lot of people that use opioids have adapted and began to use fentanyl in that time, and their bodies have adapted as well. And so many people use fentanyl for recreational purposes. There are some people who prefer to use fentanyl, and from an overdose prevention strategy perspective, as well as from a harm reduction perspective, that's fine. We don't stigmatize or judge the person due to the preferences that they have. And there are other reasons why people may use fentanyl. So for example, to avoid positive drug screens, because fentanyl does not show up in routine 5-panel drug tests. Like heroin would show up and other opioid analgesics will show up as well, but fentanyl would not show up. And this may have changed over time. Other clinics may have started testing for fentanyl, but historically, when this started to really impact overdose deaths in the city around 2015, 2016, a lot of people were using it for that reason. Some people also use fentanyl to get a stronger high. So for people who have used opioids for a long time, they use it to avoid withdrawal. And when they use fentanyl, which is a very strong opioid, it may have been the first time they had gotten high in a long time. And some people prefer that, or may have switched to it because it's what was available or because it's more affordable. And some people also use fentanyl because they're familiar with it. So for people that are newer users, people that started using within the last 3 to 4 years, that may be the only opiate that's on the drug market or in the street market. And that's the drug that they prefer because that's the only drug that they have available to them. Next slide, please. So for fentanyl-involved overdoses, some of the symptoms that you might see are chest wall rigidity, sometimes called wooden chest, so a very stiff chest, lockjaw, and also someone might need more doses of naloxone. So usually if someone is having an overdose from like prescription pain medication or from heroin, they should be able to be revived with between 1 or 2 doses of naloxone or Narcan, which is the medication that reverses overdoses if someone is having an overdose. But because fentanyl is so powerful, there have been instances where someone might need 2, 3, 4 doses of naloxone to reverse it. And because the onset is so fast and is short acting, the overdose might occur in a matter of minutes instead of a matter of hours. And so because of that, it's very important to be able to respond to an overdose quickly if we feel or if we see that this is happening, because it could save someone's life if we intervene sooner than later. And because of that, fentanyl education is important for all people who use drugs. There's often a lot of stigma amongst people who use opioids and an idea of what someone that uses opioids looks like. But people use drugs everywhere. Like we likely have friends or family members or people that we work with that use drugs, whether they be opiates or not. Everyone that uses drugs is at risk of having a fentanyl contamination. And so because of that, it's important to just make space to talk about harm reduction and have risk reduction practices, because we can save someone's life that way. Next slide, please. So as I mentioned before, fentanyl is a game changer. This wasn't something that was extremely common 10 years ago and something that people had to worry about. But now, we have to use overdose prevention and naloxone for all people who use drugs, not just for people who use opioids. And the risk of opioid overdose, again, is higher for people who don't use opioids, that are opiate naive. And it's important to have these strategies for everyone that are friends and family of people who use drugs, because naloxone, that medication, is helpful if someone else is present. If someone is not present to administer the medication when someone is having an overdose, that person may pass away because it needs to be administered. Someone that is having an overdose can't self-administer the medication. So the more people we have trained, the more people that have naloxone available to them and can respond to an overdose, the more likely we are to save lives. And like in the data slide, it showed that there were over 1,200 people who passed away of an overdose in 2019. And that's a lot of people. That's a lot of friends, a lot of family members, mothers, children, and so every life lost leaves a ripple effect that really impacts a lot of people and really hurts a lot of people. And so the more that we can collectively do to support our community, we can reduce that number in the years to come, hopefully. Next slide, please. Okay, so now I'm going to talk about fentanyl test strips. Next slide. And fentanyl test strips are a tool that could be used to identify fentanyl inside of typically powders, but any drug that can be dissolved in water. And they're a really helpful tool. However, there are definitely several benefits and several concerns with the fentanyl test strips. So I'm going to go over those. I'll start with the benefits. So the benefits are that the test strips are highly sensitive, meaning if they detect fentanyl in the drug, it's very, very likely that there is fentanyl in the drug. And I'll talk about a few exceptions to that, but generally they're very good at detecting fentanyl in a drug. The test strips are also inexpensive. They cost about $1 per strip. And the test strips provide low threshold opportunity for risk reduction education and engagement. So if I have fentanyl test strips, I can use this as a way of explaining to someone how they work and also engaging them in further conversation about other ways of reducing risk, like using naloxone, not using alone, using less, for example. They're also easy to transport, so they come in small packages. I wish I had one to show, but there's pictures later on that I can show. But they're small packages, and they can fit in like your pocket or in your bag, so it's easy to transport. And they might prevent overdose if they're used properly and they're interpreted accurately and combined with harm reduction practices. So there's a kind of a lot of factors that need to go in order for it to reduce overdose, which is where I'm going into with the concerns. So a couple of the concerns are that people might misinterpret the results and there could be user error. So for example, the fentanyl test strips, when it is positive, it has one line, which is a bit different from a pregnancy test, for example. Like when there's a pregnancy test, usually there's 2 lines. And so there have been instances in the past where people forget the instructions, look at the strip, they see 1 line and assume that that's negative, and it's not, and so that's an example of user error. Another example of user error is not using the correct dilution for water. So I'll go through that in a second as well. But that can also lead to some incorrect results. Other issues are false positives. So saying that there's fentanyl in a sample when there isn't, or negative results. So saying that there isn't fentanyl when there in fact is fentanyl, can lead to an inaccurate risk assessment. So if someone does something wrong and it says that there's not fentanyl in it and they use the drug, they may still be at risk for an overdose if they're not seeking fentanyl. The test strips also do not provide information on the potency or the concentration of the fentanyl. They also cannot detect every fentanyl analog in the market. So there are some fentanyls that are relatively weaker and others that are very, very potent and very would increase the overdose risk for folks by a lot. But there's no way to differentiate between these with the fentanyl test strips. It's either there's a kind of fentanyl that's in there that's present, or there isn't. And at the present time, the fentanyl test strips are very reliable. They're pretty good at identifying fentanyl in the drug supply. However, we know that with prohibition and with a lot of the changes in the drug supply because of manufacturing issues or different laws that come in that get implemented, sometimes the manufacturers create new analogs, meaning new kinds of fentanyl. And over time, if this continues to happen, there may be a new type of fentanyl that may not be identified by the fentanyl test strips. And then at that point, there is a possibility that the test strips may not identify fentanyl that's in the drug supply. And also a negative test result might lead to a false sense of security. So overdose is still possible even when fentanyl is not present. So if anyone's using drugs, the drugs themselves, even if there's not fentanyl in them, can still be very strong, or they can have other substances in them besides fentanyl, such as benzodiazepines that might increase the effects. Or there's a new drug that's coming into the supply called xylazine, which can exacerbate the risk of overdose, which is not fentanyl. So it's always important to let people know that there isn't fentanyl, but they should still practice risk reduction strategies, which I will talk about in a second. Next slide, please. So I mentioned analogs a lot in the last slide. So fentanyl analogs are basically the same drug with a slightly different chemical structure. Meaning that the structure has been moved slightly so that it is technically a new compound, but it's still the same drug. So this shows 2 different kinds of fentanyl. And the fentanyl test strips can identify 9 different fentanyl analogs. But in the case that more fentanyl analogs were continued to be made, then that could trigger some potential issues. Next slide, please. And these are the fentanyl analogs that can be identified, fentanyl and fentanyl analogs that can be identified by the fentanyl test strips. And so now I'm going to talk about the practicalities of how to use fentanyl test strips. And this will also depend on what drugs are being tested. Some drugs are more straightforward. Other drugs require a bit more precision. So these are a few measurement considerations. So the first is measuring out 10 milligrams of your sample. I'm going to refer to that throughout the presentation. And that can be difficult to do. So one tool that can be helpful to use is microscoops. And these are the little black spoons that are shown on the screen. These spoons can be purchased online and they can measure out about 10 milligrams. And if that's not possible, then someone can measure out about 10 milligrams using the green hair on Abraham Lincoln's head. So if you have a penny, you can try to measure out that way. And that's about 10 milligrams if a scale is not available or if microscopes are not available. The other thing that I will mention throughout is measuring out 1 teaspoon of water. So 1 teaspoon is approximately 5 milliliters of water. So here there's a photo of sterile vials, sterile water vials, which are 5 milliliters of water. And if you don't have the ability of getting sterile water, then you can also use a teaspoon. And a teaspoon is also 5 milliliters of water. Next slide, please. Okay, so this is going to be a lot of information. This information is available online on our website. We have an instruction pamphlet on how to go through all of this. But if anything is unclear, feel free to leave some questions and I'm happy to answer them at the end of the presentation. So there's a few options that you can take to use fentanyl test strips. The first option is to test everything that you intend to consume. And the reason why we suggest this as an option is because if there is a sample of a drug and there's fentanyl here, but you only take a sample from here, you know, if you consume this entire sample, you may still be at risk of overdose. And so if you have the ability, or if the drug that you're consuming is able to be dissolved in water, or if you're not in a rush and you can dissolve it in water and then wait for it to evaporate, then this might be the best option in terms of reducing your risk of overdose. So you want to dissolve all the drug that you intend to consume in a small container. Then if you are testing anything that is not MDMA or meth, then all you would do is add 5 milliliters for every 10 milligrams of powder that you're testing, which can be, if you're testing your entire sample, can be difficult depending on the amount that you're consuming. But if you have the microscope or if you have a way to measure it or weigh it out, then that's the most accurate way of doing it. But you don't want to add too much water. You want to add 5 milliliters at a time until the sample is completely dissolved. And then once that's dissolved, then you are going to insert the test strip and wait for a result. And I will go a little bit more through that process at the end. But this is more going through the dilutions. And if you're testing meth or MDMA, these have been known to trigger false positives with fentanyl test strips. And so for that, we add a little bit more water. So for the drugs like heroin, cocaine, ketamine, those other substances, we use half a teaspoon. For meth and for MDMA, we use 1 whole teaspoon. So stir the contents until they have thoroughly dissolved. And if it's a pressed pill, there may be something called a binder, which is the substance that holds together the drug. That may not dissolve, but that's okay. It can still be tested. And with this option, because all of the drugs are dissolved in water, after they have been dissolved and you have tested them, then you can snort them using a clean nasal spray device. So kind of like when you take like nasal spray for when you're sick, you can dissolve it in something like that, or you can wait until the water evaporates in order to use them. Next slide, please. The next option is to test the residue inside of a baggie. So this option is less accurate than the first, but it provides more residue from different areas of the sample. So in this one, there would be a bag, like a baggie that the drugs are placed in. The drugs can be shaked up in this bag, and when it's shaked up, it will leave a small coating on the outside of the bag. Then the bag can be opened, the drugs can be dumped out and placed aside, and then what's left in the original bag is a light coating of the drug, which is the drug residue. This provides a bit more information because it takes different angles of the bag inside of the baggie. And so water can be added to this and using the same method that we talked about previously. So if you're testing anything that's not MDMA or meth, then add half a teaspoon and then make sure that some of the residue gets into that water and then use the fentanyl test strip. If meth or MDMA is being tested, then you want to add the full teaspoon of water instead of half. And same thing, you want to try to stir the contents until it gets into the water and until it's dissolved. But if it's a pressed pill, it's okay if it doesn't dissolve completely. Next slide. And then option 3, this is the least accurate option and should only be used when the other options are not available. And so for this option, you're just taking a very small amount of your sample and dissolving it into your water. So using the same dilution as before. So you want to take about 10 milligrams of the crystal or powder. And if it's MDMA or meth, then you want to add 1 teaspoon, so 5 milliliters. And if you're testing anything that's not MDMA or meth, like ketamine, heroin, cocaine, then you want to use half a teaspoon, and then adjust from there. And then after that, you put the fentanyl test strip in, and then you wait for your results. And I'm going to give more detailed explanations for that in the next slide. Okay, so here it shows what the instructions would look like. So you would open a test strip and hold it at the top. There is an area that is blue that has little wiggly lines that would go into the water. And then you dip that bottom part of the test strip into the water or the residue mixture and hold it there for about 15 seconds. And then you lay the test strip flat on a clean surface. So like it's shown, in some cases, they would take that and balance it on top of the container there that they're using for holding water, and wait for the results to show up. And this can take anywhere between 2 to 5 minutes. And then after about 2 to 5 minutes, as shown in the image here, if there are 2 lines, then that shows that it's negative. And if there's 1 line, it shows that it's positive for fentanyl or for the fentanyl analogs that are present in the sample. Next slide. Okay, and so if the fentanyl test strip comes out positive, then the drugs have fentanyl in them. Although this test cannot tell participants what type of fentanyl or how much fentanyl is in their drugs. In this situation, some people who are not seeking fentanyl may decide to not use the drugs if they test positive for fentanyl. Other people may choose to use other risk reduction strategies, which I will go over in a second. Next slide. And if it's a negative test result, then it's according to the fentanyl test strip, there is no fentanyl present in that particular sample that you tested, not in the entire drug if only part of it was tested. However, fentanyl may still be present because new fentanyl types or new fentanyl analogs are created over time, and the test strips in its current form cannot detect them all. Generally, they have been pretty reliable from the different programs that have used fentanyl test strips, but this is always a possibility. It's also still possible to overdose. There are a number of things that can make an overdose more or less likely besides fentanyl, like the strength of the drug or changes in tolerance. So if someone's using a lot of a particular drug that doesn't have fentanyl in it, they can still be at risk of an overdose. And so we recommend universal safety tips for all people who use drugs, which again, I'll go over in a bit. Next slide, please. And the last result is an invalid test result. So if a test has 1 line in the bottom of the test area, so if you go back 2 slides, thank you. There is a line on the top closer to the solid blue. An invalid test is when there's 1 line on the bottom. So that means that something happened and the test strip wasn't able to get an accurate result. So next slide, thank you. Another way that it's invalid is if the line doesn't go all the way across the test area, or if there are no lines at all, then the test is invalid. An invalid test means that the participant needs to have another test strip available so they can retest their drugs and hopefully get an actual result this time. And if they don't have another test strip available, then the participant really has no way of knowing whether there is fentanyl in their drugs. And in that case, we would recommend universal safety tips for all people who use drugs. Next slide. Okay, so now I'm going to talk a bit about overdose safety planning. Next slide. So as I mentioned earlier, harm reduction is a way of reducing risk. So we know that people are going to engage in behaviors even though they are illegal, unhealthy, or could be harmful for themselves or for others. Some of these include using drugs, as well as having unprotected sex, driving really fast in your car, even though you pass the speed limit, crossing the street without looking both ways. These are all risky situations that some of us face on a daily basis. And the goal of harm reduction is to keep people informed and to give people resources to make the safest and most informed choices that they want to make. Harm reduction also enables people to take steps towards living a healthier lifestyle, given the conditions that they're in. And within a harm reduction framework, abstinence is not the only option. So for some people, abstinence may be the goal. However, there are lots of reasons why someone may not be able to be abstinent or may not be able to achieve abstinence in the current infrastructure or framework that is being offered to them. And so from our perspective, we want to do whatever we can to reduce risk and to save as many lives as possible, particularly now that we're living in this time of the overdose epidemic. Next slide, please. And so some examples of harm reduction, besides what I mentioned before, are like seatbelts, helmets, condoms, dental dams, nicotine patches, and gum. And some examples related to harm reduction and drug use are stopping using drugs, medication for addiction treatment. So for example, methadone or buprenorphine, safer use, supplies, syringe exchange programs, and naloxone or Narcan, as well as fentanyl test strips. So if anyone else can think of other examples, you're more than welcome to put those harm reduction items or strategies in the chat. Next slide, please. So this is an overdose safety planning sheet. This is mainly for people who use drugs, or if you know someone who uses drugs, then this is some helpful strategies to consider. So a safety plan is a personalized, practical plan to help navigate and think through risky situations. So oftentimes overdoses are not planned. The situations that happen before and after an overdose are not planned, and they can be very chaotic. And so creating an overdose safety plan can be helpful for the person so that they have an idea of what to do in an emergency situation that might otherwise lead to, shock or being frozen or not knowing how to react. And a few things to consider are who you use drugs with. So if you're using with someone that you trust or someone that you don't trust, and how that relationship might impact how someone chooses to respond during an overdose, as well as where you use drugs. So if you're using alone, or if you're using near people, or if you're using in a group of people, or what particular location you're using in, how the drugs are being used. So if someone's choosing to inject them or snort them or take them orally, as well as being prepared with naloxone and post-overdose care. So some specifics can be agreeing at what point to call 911 for support, or like what steps to take, who to tell in the moment that this happens, just so that there's a plan in place if this were to occur. Next slide, please. Yeah, so some risk factors for overdose include changes in tolerance. So if someone takes a break for a long time, taking a lot more than usual can lead to overdose. Mixing drugs. So sometimes mixing drugs can exacerbate how the drugs impact one another. So for example, if someone's using alcohol and benzodiazepines like Xanax, that can exacerbate overdose, as well as benzodiazepines and opiates, things that compound on each other, as well as variation in strength and content of street drugs. So someone may reliably go to one person for their drugs, but that person may not be aware of how strong the drugs are over time. And the drugs can go from being a certain strength to being a lot stronger in an unexpected period of time. So that's something to be aware of. As well as previous non-fatal overdoses. So a lot of research has indicated that people that have had previous overdoses are at highest risk of having an overdose again. And another common risk factor is using alone. And there's a lot of factors that influence this. Some people may not have friends or family that are supportive of their drug use or allow them to use in a particular area. And so people may use by themselves so that, so they can use somewhere. However, if someone is having an overdose and they're alone, no one's there to reverse the overdose. And because of that, that can lead to a fatal overdose. Next slide. Okay, so the universal safety tips that I mentioned previously, these are a lot of tips that we would recommend anyone who is using drugs, regardless if the fentanyl test strip indicates that there's fentanyl in their drugs or not. And this talks a bit about what I mentioned in the previous slide. So the first is being careful if you take a break or if you miss doses. So using less always to start out to see how strong the drug is or how it feels to someone, going slow, also using with someone else present. So if someone is using with someone else, it's good to take turns so that one person can use and the other person can wait and make sure that they're okay. And if they don't have an overdose, then the next person can use and they'll have the other person that's there for support if they need it. And if there's more people present, then that can help as well. And if you overdose, it's important to have someone around to help with naloxone and also to have a phone in case you need to call 911. Something else that's helpful is to encourage folks to go slow. So injecting or ingesting a small amount of drugs just to see how strong it is before using the rest. Also avoiding mixing drugs. So as I mentioned earlier, alcohol, benzos, those can increase risk of overdose if they're mixed. And if someone chooses to mix the drugs, then considering the order and also using less of each drug. Yeah, and then another recommendation is to test your drugs. So if you have the ability to go to a harm reduction program or a syringe service program in New York City or get in contact with us, then they can test their drugs for fentanyl when they're not intending on using fentanyl test strips. Another very important way of supporting someone if they're potentially at risk of overdose or if they use drugs is by carrying naloxone. So if someone's using, showing them where the naloxone is and how to use it, and leaving it in plain sight when using. That way, if something happens and someone passes by, they see the naloxone and they can respond with it. And in some cases, as I mentioned previously, more than one dose may be needed. And once a safety plan has been discussed, so who you're using with, at what point you want to call 911, what to do, things like that, then you should share that with those that you care about or that know about your use so that they're aware of the plan that you have for yourself. Next slide. And so what are other ways that we can reduce overdose risk? And now I'm going to talk about, next slide, the naloxone training. Next slide. So I'm going to give a bit of background information of how naloxone is used and the ways that they impact the body that allows for it to save people's lives in the case of an opioid overdose. So naloxone's only function is to reverse opioid overdoses. It has no effect if opioids are not present, and they are available as a nasal spray. So the top one, they would go into the nose and you spray it like a regular nasal spray, or an intramuscular injection. So it would be drawn up in the syringe and then injected into someone's larger muscles like their arm or their thigh or their butt. So I just want to reinforce that point that if naloxone is given to someone that is not having an overdose, it's like water or saline solution if they're not on any opioids. It doesn't cause any harm to any person. And it's been shown to be safe for pregnant people as well. There are no negative side effects, but the negative side effect is that it could put an opioid dependent person in withdrawal. And that will feel very bad for that person. And I'll talk a little bit about that later. But naloxone is not addictive, and there is no potential for misuse or dependence. And responders have liability protection in New York State, which I will also talk in a bit more detail about. But there's something called the Good Samaritan Law, which says if a recipient, which is the person with naloxone, which is, like people like us that choose to have naloxone on us when we're going around the city or, when we are traveling and things like that. A recipient acting reasonably and in good faith and in good compliance shall not be subject to criminal, civil, or administrative liability solely by reason of such action. Meaning, if you see someone having an overdose, or if there's a situation where someone's having an overdose and you're present and you have naloxone and you administer it to them, even if something happens, like that person dies anyway, or there's other potential criminal issues that come up, you're protected by that law. And again, I'll go into this in more detail. And communal or shared access is allowed under the regulation. So, a household can share it or businesses can share it. It's still covered under that law. Next slide. So how does naloxone work? So here it shows the brain, the little gray that you see there, those are the opiate receptors. And in this image, the purple is the opioid. So this person has just consumed opioids of some kind, and the opioids are binding to the opiate receptors. And in this case, the person was having an overdose. So what happens when someone consumes too much or too many opioids, it causes the respiratory system to slow down. So someone's breathing will become very slow and very shallow. And over time, this can lead to a person not breathing at all. And so there's just less oxygen running through their body. There's less oxygen getting to the brain. In some cases, which I'll go into more details about what a person that's having an overdose looks like, an opioid overdose looks like. They may have blue lips because of the lack of oxygen. They may look very pale. Also, if you were to squeeze the nail beds of their nails, instead of turning red, it could turn pale, gray, or blue, depending on the pigment of their skin. And so when you give someone naloxone, like they just gave this image, next click, then it would cause the naloxone to bind onto the opiate receptors, which would kick off the current opiates that are on and allow the person to resume as they were before. So if they were going into respiratory depression, then they would start to breathe again, and they would get more brain oxygen to their brain, oxygen to their body. And it usually takes effect within 2 to 8 minutes to restore breathing. And it usually lasts for 30 to 90 minutes. And that detail is important because we usually encourage people to seek medical attention afterwards, because if someone comes out of an overdose, they may be feeling very sick or very bad, and the instinct may be to go look for another source to use, which could again endanger them and going into an overdose again, because this only lasts 90 minutes, and then it could potentially put the person back in an overdose. Next slide. So this is how to respond to an overdose. Next slide. So I'm going to go over the signs of an opioid overdose again. So first is a person who is unresponsive or unconscious. This is different than someone who may be just like nodding out. Like, if someone's nodding out and like looks like they're falling asleep, or, they're still conscious. They're still standing upright or sitting upright. But at a point of an opioid overdose, they're unconscious. They're not responsive. They may have very slow or stopped breathing. In some situations, they may be snoring very loud or have gurgling sounds, which is labored breathing. They may have blue, gray, or white lips, as I mentioned before, or nails, and also muscle stiffness or rigidity, like the chest wall that we mentioned previously, because of fentanyl, if they're having an overdose that involves fentanyl. Next slide. So these are the steps that you should take if you think someone might be experiencing an opioid overdose. The first thing is to shout. So, call their name or say, "Hey, are you okay?" Try to wake them up and tell them that you will call 911. And hopefully they respond. They say something like, "No, I'm fine," or whatever. If they don't respond, if they don't make any noise, or if you notice that they're not breathing, then the next thing to do is do a sternal rub. So using this part of your knuckles, because if you rub it really hard against your body, it hurts. You would grind it against your chest really hard, or across the person's chest, and try to wake them up, because that pressure on their breastbone or their sternum really hurts. And if the person is just in a deep sleep, or they may have drank too much alcohol, or those kinds of situations, they'll likely wake up. But if they don't wake up, then that's another trigger point to continue trying to reverse an overdose. Next slide. And so, as I mentioned earlier, it can be difficult to tell the difference between when someone is just high or maybe very intoxicated on alcohol or things like that. or if they're actually experiencing an overdose. So if it's not an overdose, if they're nodding in and out and they're semi-conscious, they're still not having an overdose. If their speech is slowed or slurred, they're still not having an overdose. And if they will respond to stimulation, then they're still not having an overdose. However, if they're having slow or no breathing or very deep snoring or gurgling sounds, that could be a sign of overdose. If they have a slow, erratic, or no pulse or no heartbeat, then that's a sign of overdose as well. And if they don't respond to stimulation, so in that case, when you're doing the chest rub, if they're not responding, that points to a sign of overdose. Next slide. Right. So in that situation, if someone is in the left, so nodding in and out of consciousness, responding to stimulation, but still kind of not fully there, the best thing to do, if there is the time to do so, is to stimulate them, like try to wake them up, see if they respond and observe them and not use the naloxone. But if the person is unconscious and is on the signs on the right, then it's an emergency and you want to use the naloxone at that time, or the Narcan. So after the sternal rub has been done, and that's important, doing the sternal rub first before administering naloxone, then call 911. So either you can call 911 or you can have someone else call 911. And when someone calls 911, it's important to give the dispatcher's address and the specific location of where this incident has happened, where the person is having an overdose, and tell them what you see. So tell them that the person is not breathing, that the person is turning blue or gray, that they're unconscious, that they're non-responsive, etc. And we want to avoid making the response more chaotic than it has to. There have been anecdotal stories from the community where law enforcement that doesn't have naloxone would show up and begin to antagonize the situation, which can only worsen the panic that is happening. Or other times where an overdose may have been mentioned on the call when someone calls 911, and then there's a slower response. And so because of that, we just encourage people to say what they see as opposed to mention anything around drugs or overdose, because we really want to just make sure that the person that is having an overdose receives care as soon as possible. So some reasons to call 911 include not if it's not an overdose. So in some cases, someone may be unconscious for another reason. And in that case, it's still important to call 911 so that they can receive care. Also for potential medical complications. If someone's having a heart attack, for example, that can be another reason to need 911 to be called and for someone to get help. And in other situations, if more doses of naloxone might be needed. So if someone only has a kit that has 2 doses and the person still may be responding a bit, but not fully responding, then more doses may be needed and a paramedic can bring that. Next slide. So this talks a bit more about the 9/11 Good Samaritan Law in detail. So the law offers some protection from prosecution to the overdose victim and to those who call 911. And these are the things that it covers. So if there's drugs up to an A2 felony offense present, so possessions of up to 8 ounces of narcotics, the Good Samaritan Law protects the person having the overdose and the person who's making the phone call if they have that many drugs on them at that time. It also protects alcohol for underage drinkers, marijuana in any amount, paraphernalia offenses, so if they have paraphernalia on them, as well as the sharing of drugs. In New York State, that constitutes a sales offense. So if 2 people were using together and one person starts to have an overdose, the other person can still call 911 and they're both protected under this law and they will not be prosecuted for having these drugs present, either on them or in their location at that time. However, there are a few situations that the 9/11 Good Samaritan Law does not offer protection, and this includes for probation or for parole violations. So if someone is in probation or parole, they may still be at risk of arrest. Also violation for open warrants, issues related to immigration. So if a person is undocumented, it does not protect them, as well as for child welfare issues. And so if there's issues with child abuse or neglect, and that becomes apparent during the call, then there's still going to be action taken. And the 9/11 Good Samaritan Law does not offer protection in that situation. Next slide. And so this is how it shows when you're actually administering the naloxone. So after the sternal rub has been completed and you've decided that I need to, give the person naloxone, then you take your naloxone, you peel it back, you place it in their nose. So there's like one section that protrudes that goes into their nose, raising their chin up, and then press. And that will allow the liquid to be released into the person's nasal cavity. So it's important to not press the plunger until it's ready to be used, because the plunger is very sensitive and you can lose the dose that way. So always making sure to place it inside the person's nose and then pressing the button, and then repeating. So giving the person the dose, waiting 2 minutes, and if the person does not wake up, then giving them a second dose. Next slide. And then if the person becomes responsive, meaning that the naloxone has worked and the person is breathing again, they might be confused or afraid. And then in that situation, you can explain to them that they were not breathing, that you used naloxone because they were having an overdose. And part of the situation is that they might be in withdrawal. So they may be feeling very sick. They may be feeling very ill or nauseous, or they may start vomiting. They may be angry in some situations because they're not sure what's happening and why they're feeling so bad, and why there's a situation now that's happening around them. But in that case, reassure them that naloxone was used and that it wears off in 30 to 90 minutes. And also remind them that using more drugs is unlikely to reduce the withdrawal, but it may increase the risk for another overdose. So encouraging the person to receive medical attention, trying to encourage them to not seek out more drugs to use. And if the person declines medical attention, it's important to try to make sure that someone stays with them for at least 3 hours after the overdose event, so that if they do fall back into an overdose, then someone is there to help them. Next slide. And in the situation that someone does not wake up after administering the doses, then you want to give the person CPR or rescue breaths. And so in each naloxone kit that someone receives, there will be a face shield that someone can use to put on their face, and that protects you from that person, from their fluids and things like that. So you want to place the person on their back, tilt their chin up to open up the airway. You also want to check if there's anything blocking the airway. And if there's not anything blocking the airway, then you want to pinch their nose with one hand, create a seal with your lips and theirs, so putting your mouth on top of theirs, and giving 2 even regular sized breaths. So blow enough air to make sure that their chest rises. So seeing that air goes in, and giving 1 breath every 5 seconds until help arrives. And it may be difficult to perform rescue breaths on a person that's experiencing muscle rigidity from fentanyl, but it should still be attempted if possible. Next slide. And the last thing is putting someone in the recovery position. There may be situations where you may want to put someone in that position so that it prevents choking. In the situation that someone feels nauseous and begins to vomit, instead of laying on their back and potentially swallowing the vomit and choking, they can be put in this rescue position where one arm is flat and another arm is on the side. One leg is straight and the other leg is out, so that they can't kind of flip over. And this position is helpful if someone is not administering naloxone to them when they're not receiving rescue breaths, and if in some situation where the person that is responding to the overdose event has to leave and they have to leave the person alone, then they can put them in this position and they won't wake up and vomit on themselves or potentially choke on their own vomit. So in the Overdose Rescue Kit, if you receive one, there are 2 doses of Narcan or nasal spray. There's a face shield, like I mentioned, 2 alcohol swabs, 2 gloves, educational materials reviewing overdose risk recognition and rescue steps and how to respond in an overdose, a Narcan instruction sheet, and a blue certificate of completion that you receive this training that I just gave. Next slide. And after you used your naloxone, so always make sure to check your expiration date. It's on the back of the naloxone. It doesn't completely expire the moment that expiration date hits, but it becomes less effective. And so it's important to be able to keep track of that and to get a new kit if your naloxone has expired. Also, there's an app called the Stop OD NYC app. And if you use the naloxone, you can either email naloxone@health.nyc.gov to get in touch with someone at the health department, and so we can provide additional support. Or you can use the app, and that app will allow for submission of that information. And it's important to get a refill if you use one or more doses of naloxone, if your kit is lost, damaged, or stolen, or if the naloxone has expired or is near the expiration date. Next slide. And so the last couple slides are just talking about naloxone access. Next slide. And you can get naloxone in various places in the city. There are many registered opioid overdose prevention programs where people can go and receive it from them. And that information is online on nyc.gov/health/naloxone or via the Stop OD NYC app. It's also available at participating pharmacies without a prescription. So there are over 1,000 pharmacies in New York City that have naloxone available. There can be copays of up to $40 that can be waived through a program called New York State NCAP. And the Medicaid plans must cover at least one kind of naloxone. So that's another option. These can also be found at syringe service programs across the city. So you can like Google New York City syringe service programs or harm reduction programs, and they will also let you know different areas in the city where you can find naloxone. Next slide. And again, you can go on the NYC WELL or Stop OD NYC app, and that has different resources about like what opioids are, what the signs of opioids are, and how to report any overdoses or use of naloxone on the app. Next slide. And you can find additional support with substance use or mental health for you or a loved one through NYC WELL, as well as naloxone. And that support is available 24 hours a day, 7 days a week. And you can call 1-888-NYC-WELL or text WELL to 65173, or you can also chat online at this web address that's found on the screen. And for any other questions, I've just realized my contact information is not there, so I'll put my contact information in the chat. So if anyone has any questions after this presentation, feel free to email me, and I'm happy to follow up with folks. So thank you. I see that there's 2 questions in the chat. So I'm in the Q&A. So I'll go ahead and answer those. So the first is, should cocaine be mixed with a 5 milliliter or 10 milliliter sterile water? So cocaine should be mixed with it's half a teaspoon. So half a teaspoon, a very, very small amount of water. And again, this depends on the amount of cocaine that's being tested. So 10 milliliters is a very small amount. So for every 10 milliliters that are used, then half a teaspoon should be used. So for 20 milligrams that are measured out, then a full teaspoon, if that makes sense. But honestly, what we have found is with ketamine, cocaine, and benzodiazepines, for example, the dilution is not super important. As long as there's enough water that the sample dissolves, it should be fine. The nuance comes more with MDMA and with meth, because those can trigger false positives. So we just want to make sure that that is dilute enough. But generally for heroin, cocaine, and ketamine, any dilution that is still about a teaspoon or a couple teaspoons is generally fine. And there's a question of where can we order test strips and or Narcan? So there are several options. The test strips, if you have the funds to purchase them yourself, they're available in a couple of websites. So I'll put the websites in the chat, but those websites are through DanceSafe, Bunk Police, and I believe there's another company that can be purchased. So I'll put that in the chat. Oh, and through the manufacturer, which is BTNX. You can go on their website and email a representative, and they'll connect you with their with the shipping information. If you don't have the ability to get them on your own because they're too expensive, you can reach out to me. We have a limited supply that we have earmarked for certain organizations in need, but we're trying to make a case for getting more. And so if you don't have the ability to get them from online, reach out to me and I can figure out where the nearest place is that you can get them, or we can figure out if we can give them to you in some way. And for the naloxone or the Narcan, that's the information that I went over. So you can go on the NYC WELL or Stop OD app, or there's a site on naloxone in the New York City Health Department page that will outline the different locations. But I would say the most accessible places are the harm reduction program. So there's 14 syringe exchange programs or harm reduction programs across the city. And they have all of these harm reduction supplies available for free. And you can get as many of those supplies as you need from those locations. And if you live in an area that is far from those harm reduction programs, there is an organization called Next Distro that will mail them out to you. And so I will put that information in the chat as well. But if that doesn't work, you can also email me and I can help you find what resources you need.
Wow, Yarelix, thank you so much for this incredibly powerful, enlightening, and important presentation. It's really been an eye-opener, and I know I learned so much, and extremely grateful to you and to the Department of Health and Mental Hygiene for coming to this place of knowing that harm reduction and life saving is the best approach right now, especially under all of the stress and pressures that everyone is facing under all these circumstances that we're in, and even existed before this pandemic and will continue well beyond. And I think it's really just so great that we are all just coming to a place of getting more real and realistic, and coming forth with education and awareness and support and compassion, really, for people who use and misuse, and to give them the tools they need to help themselves and others. So I'm just extremely grateful for this opportunity to share this important information. I did have one question that maybe we could also share, which is if people are owners of venues and would like to perhaps train their staff, or to make sure that there is Narcan behind the bar, just like they had with their CPR kits and everything else and their first aid kits, how can we make sure that they can have the training and the supplies that they need?
Yeah, so you can reach out to me directly, and I can connect you with the overdose education and naloxone team at the department. But we actually did a campaign in 2019 where we went out to hundreds of bars, and we trained staff and managers, and we had them have naloxone behind the counter, which is wonderful. And there was actually a report of someone having an overdose reversed and life was saved from a bar having naloxone, which is wonderful. You know, it's really what we're aiming to happen. We want to protect as many people as possible. So I think in order to have, if you want to have an in-person training, the only ask that we have is that there's 15 people or more anticipated to be at the training, so that, you know, we can come out there and provide this in-person presentation. If there's less, then we can work with the organization to try to coordinate like a drop-off or an online presentation, so they can still have that training, and then they can have that naloxone behind the counter. Yeah, so we're happy to support in that way. And there's, as we mentioned, like having naloxone is protected by the Good Samaritan Law. And so we also don't want organizations to feel concerned that, you know, having naloxone might be a liability or might put their business at risk. Like it absolutely doesn't. It just protects the patrons that are coming, and, you know, can reduce that overdose that may potentially happen.
That's really good to know. We have gotten a lot of questions and concerns about that fact. And so thank you for clarifying it. I just want to let you know, first of all, thank you again. This has been extraordinary. And also to let everyone know that this presentation has been part of the Office of Nightlife Elevate Nightlife Mental Health Initiative, which is really here to help support the mental health of the nightlife and hospitality industry with free and affordable resources and support and information. So you can get, we also have a weekly free collective trauma support group that you can log in online every Monday at 4 p.m. And you can go to this website to see other resources that we have to help you with a personalized mental health plan. If you would like one. Again, we've done this overdose prevention webinar, and next week on Wednesday, we're also doing another webinar on suicide prevention and bystander training for the nightlife industry and community. So being able to recognize depression and suicidal tendencies, not only in yourself, but perhaps your coworkers and even patrons across the bar. So this is part of our overall harm reduction initiative at the Office of Nightlife with our partner Yara Leaks over at the Department of Health and Mental Hygiene. And I just want to thank you all so much for joining here today and for being strong and resilient and brave, and wishing you all the best, and just to stay safe and to know that we are all in this together and we're here for you. So feel free to reach out anytime with any questions, concerns, or ideas. And we will leave this webinar open for a short while so that you can go into the chat to be able to get some of the links. Yara Leaks, if you want to add some that you haven't already, we'll leave it up for a few minutes so that we can add some links for everyone and so that you can capture them for yourselves. So in the meantime, take care, and we'll be in touch with you soon.